are you okay with what the questions, what we're doing here? Are you?
Yep.
So we've
but
got.
Do remind us, Mark, if that's possible.
You could remind.
Yeah, that's fine. So
Okay.
we've got 20 minutes in total. Well, we've got to be finished by 10:10. So the first bit is to discuss what you would consider is good practice, particularly any examples you would consider outstanding in kind of one of the areas where you might work, and then the break that down into how do you know that this is good practice? How would you demonstrate this so that a peer inspector would recognise it? So that's our first task. So should we just concentrate on that bit first about some examples of good practice, and then how do you know it is? What evidence would an inspector see that might recognise that? Does that
Lovely.
make sense?
Thank you, Mark. Can I just check? So Ailish and I have our cameras on. Are you preferring not to have them on, or it would be lovely to see you?
Yeah, can you
Yeah.
see? Okay, yeah, I can come on now.
Oh, that's much nicer.
Yeah.
So you're actually talking to people. Hi, Pima.
Hi, Pima. Are you on the moon?
Yes, it looks like.
Yes, it's just the background. We play with.
Would be worth having a quick introduction.
I'm one of the physio with the learning disability team, and
Nice
I'm the junior. Yes.
And nice to meet you. Is it Pima? Is that how would you pronounce your
Pima? Yes.
Pima. Pima, do you know Ailish and Gurkha at all?
No, I know them since yesterday.
Yeah.
Okay.
See me doing the yoga.
Yes.
So have you anybody got anything that they can suggest in terms of something that they think is that they've observed within their own teams? Is there anything you can think of that you thinking of? Is there anything that you kind of feel quite proud about, or something that you think is is good about the team that you work with, things that you do?
I think as a team, if as a team we really get on well within the team members, and this is particularly what I have worked with intermediate care before, and I have worked in private practice, and but I wanted to come back to learning disability team, especially because the team within, it gels on really well, and there is no sort of hierarchy. We can approach our seniors easily. There is no hesitation to approach them for anything, whatever concerns it might be. So that is what I think. That is, I don't know, as a team.
Good.
I don't know what if you're looking for these kind of things,
but
that really works out well for me.
Yeah, no, definitely. And so I guess taking that then, what would an inspector observe that would tell them that this was the case? What would they be able to see as evidence for the fact that you have got this kind of lack of hierarchy and that senior staff are approachable?
I don't know. How would you see that?
Yeah.
It's difficult, isn't it? Unless they come and observe us do our work, sit with us for a day, or it's difficult for them to sort of seeing that CQCs are more with paper-based rather than observation. That is what I have always had, this impression of CQCs always looking at papers and things rather than going into some sort of service and actually going down to the root level and looking at how things are. I think that is my impression of CQC. Sorry.
Yeah. So if a CQC inspector was to sort of shadow you for the day, I know obviously at the moment that's more challenging, but if an inspector was to be shadowing you, what might they see during the course of a day which might make them think, oh, there's not so much hierarchy and people are approachable? What would you? What might happen
so for
in
example,
a day
if for me, supposing if I was if they were to shadow me and then they found during the course of the day I came up with a solution problem that I couldn't find a solution to, then they could see that how easy is it to approach my seniors around it.
Yeah.
You would be able to see that.
Yeah. And so is there usually a senior member of staff around when you're working?
No. It will be telephonic.
Okay.
Because we all go to different visits.
Yeah.
Yes. And that is one. And then they could also, apart from the team members, what if they came around with us, they could see how any of the members, if they shadowed any of the members, they could see how well we bond with the client.
I mean, do you have governance meetings, Pima?
We have service-led meetings on Tuesday. Yeah, we do have sort of governance meetings.
Are there opportunities for you to raise issues, raise concerns, and discuss that openly with each other? And is that minuted?
Yes, it is. We do that every Thursday of a month. We have our staff meeting, and then I can raise my questions or any problems that I have anytime. We could email and then, ask for a slot, and then we can do our meeting. But apart from that, we have a referral meeting every Thursday where, our referrals are discussed within the team. And within that also, we can still bring so there are a lot of opportunities that I can go to my seniors to talk about.
And are the referral meetings minuted in the same way that the Thursday staff meeting is minuted? So I guess that would be another example that the CQC might be able to do, is that they would probably look at the minutes of those meetings, and there would more than likely be some entries within those minutes to show that sort of staff were raising issues and that the team was perhaps discussing those issues and finding solutions together as a team.
Yes, and we have regular supervisions, which is again our team leaders made it how important it is to have regular supervision. So you've got a meeting minutes, you've got a supervision there. Yeah, those are things that they can look into, definitely.
Yeah, and so your supervisions are recorded, are they? Do you keep a record of your supervision sessions?
They are all recorded. They do have minutes. Yes, we have regular PDRs. And supervisions. Good. Yes,
that sounds like a really good example of something that you're quite rightly proud of in terms of the team that you work with. Ailish and Gerda, is there anything from your perspective that, having started to hear what Pima was saying, has that fired off any thoughts for yourselves in terms of things that you feel that your team does particularly well?
Very much. Sorry, go on, Ailish. We both started that.
No, I was just going to echo that that's something probably that our team I feel quite strong about our team, that it's a strong team, that you can rely on your colleagues, that you can go to them if you need anything, if you want help with anything, if you think you've done something wrong. There isn't that judgment. There is that shared sense of responsibility within the team, I'd say. Don't know what you were going to say, Gerda.
Yeah. Very much so. And I guess there, things that come together just or come to mind listening to yourself, Pima, that sense of communication. So that really being linked, connected, and kind of really that support between colleagues. And I think with regards to when, an inspector would come, first of all, that, supporting each other, kind of really being there for each other with regards to ideas, but also able to say, I don't think that, I have another idea, which is, a great, I think, ability to, to do that, also to kind of really contribute to the team. And I think with regards to where, I know Pima, you said about paperwork, but I guess, you know, for example, where we keep all our information, so having like a shared document where everybody can actually see what's happening, also that sharing of like roles and responsibilities with regards to what each of us is involved in, and kind of sharing that information and ensuring there are kind of opportunities for everybody in the team. So yeah.
And do you feel, Gurka, that that could be evidence that an inspector could see all those things that you were talking about, that there would be ways in which that would get picked up?
Well, I guess it's, I would think so. Obviously, we can, I don't know how it works. You know, I haven't been part of a CQC inspection when people actually come and observe and go through papers. But I guess, you know, you have interviews with them, don't you? So you do share information that way. Also, of course, it's all there so people can have a look if they wish to. It's all very accessible. So yes, I guess.
Yeah. So it's okay. Yeah. So it's kind of minuted within meetings and I guess observation, a bit like Pima said. Really, it'd be similar sort of methods for the CQC to pick up. I'm just aware of time, and I want to make sure we get the opportunity to deal with both of the questions that we were dealing with. So is it all right with you three if we move on to the next question? Made a few notes of things that you've said in case we have the opportunity to give a bit of feedback after we've done the breakout. So let me just go to the other question. So the second question is, discuss what the challenges are in your area. So areas where perhaps things aren't going as well as you'd want them to be. And then what sort of evidence is there that would highlight these to a peer reviewer, and how would you show what has been done so far to combat the challenges? Does that make sense? So it's perhaps it's the flip side of what we've just talked about. It's areas which you feel, you know, aren't so strong, that perhaps could do with improvement, and it's about what evidence is there to suggest that that's the case, and what evidence is there that what you've already started to try to do to tackle those issues. Okay, does anybody want to start us off with it?
I know I was thinking about, so I can't think of the exact examples, but when on the wards and things, there's often a lot of audits where they'll come back with things that are like, you know, you're not doing your physical health checks, and there'll be an audit on that. And what I found is helpful, and what I've seen worked with what I did and what I can now see with some of the new governance officers that are there, is that rather than just giving the results each week, you know, you're in the red, you're not getting the right results on this audit. It's actually going and trying to work out the why. So why, and trying to get people involved about why it's important. Why are we doing that audit? Why are we asking you to do so many checks per day, or whatever it is you're being asked to do? And working out the whys and trying to get people to understand that, to make them then increase on the audit. Because I think the challenge is if you just get presented with data the whole time that just says you're not performing here, you're not performing there, you're not performing here, and you're just bombarded with all this information that it's you're not doing this, you're not doing that, it just becomes overwhelming. Whereas if you maybe focus in and look at the whys about it, then that people can then get on board.
Okay, so let me just make sure that I've understood this correctly. So if I just check this out with you, Ailish. So I think what you're saying, one area where you think things aren't as good as they could be is in terms of the impact of audits. So that audits aren't perhaps being as impactful as they might be.
I think if we need the audits, but if we just do the audits and then just present the audits back, they can just become a negative thing. So if you're not performing on the audits and you just every week get that you're not performing and you're not achieving, you're not getting into the green or whatever, then it just becomes, oh, well, we never really achieve on that. So it's about how you present.
Okay, so is it that the audits aren't achieving what they're set out to achieve? Is that the issue? Or I'm just trying to understand what the area is that for improvement. What is it about audits that's not working?
So it's It's about
is it the effect on people?
it can be the effect, because I think it can be quite negative. Can be quite make you quite feel fed up if you keep getting red, keep getting red. You never feel like you're achieving anything.
And what happens as a result of that? So if people are getting fed up as a result of the audit, what does that then result in? What happens?
I think you become despondent. You won't if you don't see the value in it, if it's just numbers being presented back at you, you don't understand the value of why you're doing something. So it's about the why you're doing it, not because you've got to achieve a target. And I think it starts to get quite to targets, which can you're on the ground working on the ground. You can be quite negative about targets, and it's all about numbers.
Okay.
And I wonder also, Mark, sorry, in terms of, it's the purpose, what Eilish is referring to as the why, but also communication, actually, that you have a shared purpose about it, rather than it being, this is what we do. It's like, what's our purpose as a team of doing that? What are we hoping to achieve by doing it, and how are we going to get there?
Fine. Okay, that's great. I mean, I guess what we didn't get the opportunity to talk about was how the inspection team might pick up on the fact that audits were having this effect. But sadly, I think the clock is against us. It's 10:10. So we can feedback as much as we did.
Sorry.
Yes, Pima. Yeah,
sorry,
go
Mark,
ahead,
to cut you through.
Yeah, no, go ahead.
Will when the effects of audits, will it not come up in your individual supervision, how staff are feeling about the audit and how negative it always is, isn't it?
It may do.
I think
that might be one source of information is the minutes from supervision sessions. Yeah, definitely. So hopefully that starts to get you thinking a little bit about maybe what the inspection teams might be looking for. So looking for areas of really good practice, and then looking for areas which need improvement, and the evidence, and where people might be looking for evidence to help them to make those sort of conclusions. And that, hopefully that helps you think a little bit more about the whole inspection process in terms of being inspected, and the kind of things that inspectors will be doing and looking, and maybe that helps us to think that those sorts of mind. Thank you.
Thank you.
For that. We'll go back